All right. Thank you all who are joining. Appreciate you being with us here today. And then give it a few moments before we get started. I guess in the meantime, while we wait for everyone to join, just let us know in the chat what area of the system you're representing. If you're external, just supporting someone, glad to have you here. Looking forward to a really good discussion. Very informative. Good afternoon. Good afternoon. I think that's Regina. Hey, Regina. Thank you for joining. Got corporate service center in here. Frank, how are you, man? Thank you so much for joining. Good afternoon. Good afternoon. We'll be getting started in a couple minutes. Melissa, Heather, CBO, thank y'all so much. Alex, thank you. And see, Melissa just gave me a really good idea. Let's show some love in the chat. Let's use a nice blue heart emoji. This is Autism Awareness Month, Autism Acceptance Month. Let's feel the love through the chat. Let's get our panelists ready for a really good discussion. Very excited about this. Anybody who knows me knows this is very near and dear to my heart. We have Nispa in the house. How are you doing? We're famous, guys. Nispa is in the house. William, how are you, man? Thank you. Thank you. These blue hearts look wonderful, people. Thank you so much. Melissa, Lisa, Roxana. 103, we are going to get started. Just giving people some time. I know they're probably coming back from lunch, just starting lunch. Appreciate you taking the time to be here with us. Got about 45 minutes to an hour, so thank you. Linda, Kristen, thank you for the hearts. Let's see some more blue hearts for Autism Awareness Month. Lisa, thank you. All right, so this is officially 103. I want to say thank you for everyone for joining us. As you know, April is Autism Awareness Month, or if you didn't know, also known as Autism Acceptance Month. April 2nd, I believe, was Autism Awareness Day. And we really were very excited to have two lovely clinicians from over at the SIVA Autism Center for Research and Treatment here, as well as my fellow colleague Yi Ting from over at Adapt ERG. That is all differing abilities partnering together. Hope I got that right, Yi Ting. Yes, I did. Awesome. And we also have Martha here. Thank you so much, Martha. I'm going to pass it to them for introductions. But first, I just want to thank the Office for Diversity and Inclusion for setting up this web link for us. I want to thank my colleagues over at the Heritage of Latinx Alliance. I am also a co-lead, and I am representing the Central Billing Office. So very big thank you to everyone over there for always being big supporters of every event that we have. And we're just going to get right into this. Really love this session because it's a chance to share information, debunk myths, and really have a transparent conversation about autism and how we can learn a little bit more and be a little bit more understanding and accepting of the fact that there are different people in the world, and we need to learn how society conform to them, not how they conform to society. And I think once we get through this presentation and some Q&A, we'll all leave this session feeling a little bit more understanding about autism. So with that, I'm going to pass it over to Paige. Paige, if you can introduce yourself to everyone.
Sure. Hi, nice to meet you all. And I'm so thrilled to see such a wonderful turnout. I am Paige Seifer. I'm the chief psychologist at the Seifer Autism Center, and I'm really excited to be here.
Thank you, Paige. Jessica?
Yes, hi, I'm Jessica Zweifach. I'm a psychologist at the Seifer Autism Center here at Sinai. Thank you so much for having me at this important event.
Thank you, Jessica. Martha?
I'm Martha. I am a master's student and I'm autistic.
Thank you, Martha. Welcome. And also, Ting.
Hello, everyone. My name is Yiting Shang. I'm one of the leads for the ADAPT ERG, also representing digital and technology partners. Thanks for joining.
Thank you. So just some quick housekeeping before we get into the presentation. If you have any questions during the session, if you can just use the Q&A button at the bottom, we'd really appreciate that. Yiting is going to be monitoring that and managing that. And we understand that this may be a tough conversation for some of you. So if you need to take a step back or step away, we totally understand. But we really appreciate you being here with us. With that, I'll pass it to Paige and Jessica.
Thank you. All right, so we have two parts of our talk today. We're going to spend part of this session really going through information, defining what autism is, going through the diagnostic process and current interventions, including providing an understanding of the educational system. So we're hoping that the first part of the talk will be really educational and informative, and hopefully we know people have different relationships to autism and are at different stages of life and different processes. So we really want to be mindful of that. And we tried to give sort of a really comprehensive overview. We're happy to answer more detailed questions at the end. And then the second half, we'll talk a little bit about who the Seifer Center is and some studies that we're recruiting for that may be of interest to you, colleagues, patients, et cetera. I also want to be mindful that we really want to be as thoughtful in our terminology as possible and recognize that, this can be a sensitive topic, and we really certainly respect everyone's personal preferences for how we refer to individuals on the autism spectrum. All right, so what is autism? So when we think of it in sort of the most concrete way, we're thinking about something called the DSM, the Diagnostic and Statistical Manual for Mental Disorders, which sort of defines criteria for what determines whether or not someone meets diagnostic criteria for a diagnosis of autism spectrum disorder. Now, one thing to keep in mind is that over the years, as new versions of the DSM have come out, the diagnostic criteria for autism have also changed. So the current edition of the DSM-5, came out in 2013. And it broke autism down into sort of two core symptom domains. So challenges with social communication and interaction. So you'll see here in the center to the left, social emotional reciprocity, nonverbal communication. So things like facial expression, eye contact, use of gestures, tone of voice, and the ability to sustain, initiate, maintain relationships. Now, for an individual to meet diagnostic criteria for autism, they have to show impairment in all three of these areas. What we call sort of the B domain, or the other aspect of autism, are restricted and repetitive behaviors or interests. And in this domain, you'll see the 2 of 4. So an individual has to have 2 of 4 of these symptoms. So repetitive speech and behavior, insistence on sameness, restricted interests, and sensory abnormalities. So what that means is, while an individual with autism must have social communication impairments in order to meet criteria, many, for example, will have sensory reactivity differences, but they don't have to have those to have autism. There's also a number of comorbidities to think about. So increases in anxiety or other internalizing symptoms. There are higher rates of ADHD type symptoms. Some individuals show greater rates of aggression. There's also language impairment and intellectual disability in about 1/3 to 1/4 of individuals on the spectrum. At the Seifer Center, we've learned a lot about the genetics of autism. So understanding that autism is primarily a genetic disorder, and we'll talk about what that means. And then there's other medical comorbidities where there's a higher rate of having things like seizure disorder or GI symptoms in autism. I think really importantly, though, understanding that autism is a really broad spectrum. So individuals with few to no words up to those who have fluent complex speech. Similarly, we see a range of cognitive ability, a range of skills and challenges. And so it's pretty cliche, but this idea that when you've met one individual with autism, it's true. We certainly don't want to sort of stereotype or generalize because it's complicated, right? There isn't sort of a test, a blood test, or to tell us whether or not someone's going to have autism. All right, so key facts about autism. So this slide we had to update just recently because the newest numbers from the CDC came out based on the 2020 census, suggesting that 1 in 36 8-year-old children in the United States carries a diagnosis of autism, and we'll talk about that in more detail as well. Boys are sort of historically 4 times more likely than girls to receive a diagnosis, but in this newer report, for the first time, there was an increase in diagnosis of females, which has been sort of a hot topic within the research community in terms of making sure that we are not missing girls on the spectrum simply because of the tools that we use to diagnose autism. Autism can be reliably diagnosed by age 2, and yet despite this, most children are not diagnosed until after age 4. And we know that early intervention and identification of challenges early are really critical. As I mentioned, we see a range of IQ. So the term profound autism is something that now is getting a lot of attention and really understanding this subset of individuals on the spectrum who also, in addition to autism, have profound intellectual disability. And then realizing that autism affects everybody. It affects all ethnic, socioeconomic groups, minority groups. And while minority groups tend to be diagnosed later, I'm going to show a slide from this new data where for the first time there were higher rates of diagnoses in minority groups. And then we know that early diagnosis and intervention can have long-term positive impacts on symptoms. And so that's why early diagnosis can be very important. And then there's no medical test for autism. There's no cure. We're not looking to cure autism. And I really want to make that distinction when we talk about treatments, in the same way that if someone comes to you or tells you they're having trouble reading, right, we're going to get them support to help them learn how to read, right? And so if an individual is struggling with any area of their social communication or behavioral functioning, the goal is to help them feel more comfortable, be able to engage in learning and in the world around them. So it's not that we're trying to change at all who people are, right? We're trying to make everyone's life easier, right? And improve skills, right? And a lot of the things we talk about are skills. And so they're things that can be improved with practice. All right, so this is data that just came out really in the past couple of weeks or so. And for the first time, Black, Hispanic, and Asian or Pacific Islander children were identified as having autism at higher rates than white children. Now, this is significantly different than the data has been sort of historically. And of those identified, about 1/3 were also diagnosed with intellectual disability. Now, this is, you'll see sort of this rising prevalence rate. This increase is actually, within the research community, sort of considered a good thing, in that we have known for a long time now that individuals from diverse backgrounds were getting diagnosed later, and probably many missed. And so this is suggesting that sort of the rising prevalence is not necessarily due to sort of some like major environmental thing that we're missing, but likely due to better screening, better access to diagnostic tests, and importantly, changes in diagnostic criteria over time has certainly led to this increase. So that'll sort of be interesting to watch, I think, over time as well. So sort of what is autism, what causes autism, about 80% of the risk for autism is caused by gene changes. But I think years and years ago, there was this sense like, oh, if we can identify the gene, right, that's going to tell us something really important. But as it turns out, there's likely as many as 1,000 different genes that can increase risk for autism. So it's not as simple as that. Over 100 high-risk autism genes have been identified, and actually there is something called the Autism Sequencing Consortium, and Dr. Joe Buxbaum, who's the director of the Seaver Autism Center, is actually one of the founders and continues to be a principal investigator on this very long-term grant funded through the NIH. It's an international effort where they're genotyping, over 50,000 samples, and they've identified sort of these top autism genes. So what does that really mean? So it means that in these high-risk autism genes, if a child or an individual is found to have a mutation or a deletion in that gene, they will, you can get with high certainty, they will have intellectual disability, and many of them will have autism. And so when we think about sort of genetic syndromes associated with autism, that's something that we're actively studying at the Seaver Center. So Fragile X syndrome is probably one of the more common disorders that falls into that category. We study something called Phelan-McDermott syndrome, ADMP syndrome, FOXP1 syndrome. In the past few years, we started studying something called DDX3X syndrome, which is actually the leading cause of intellectual disability in females. And so we'll talk more about the sort of genetics first approach when we talk about the research we're doing, but it is really allowing us to sort of subtype patients based on underlying similarities in genetic variation. And then while there are certain environmental factors that are associated with autism, it's important to mention that these environmental influences are considered to further increase risk for people who are already genetically predisposed to autism. So things like having advanced paternal age, certain birth complications, close together pregnancies. But again, these increases are small, and you don't want people to make decisions about sort of childbirth necessarily based on these factors. Thinking about, I know Sean mentioned this idea of dispelling myths. Really importantly, vaccines do not cause autism. I mentioned you can look up the CDC, the American Academy of Pediatrics, that describe comprehensive lists of studies showing this, and also the fact that that initial study that came out that created a lot of hype was actually debunked. And so this is something that we certainly feel very strongly about. All right, so most children on the spectrum have documented concerns in a medical record before the age of 3. And I think this is really important for all of us as parents, as friends, as family members, as employees at a hospital, right, to realize how important it is to sort of address the concerns when we hear them. So despite this, less than half of children receive an autism evaluation before the age of 3. About 19% receive evaluations between 3 and 4, and about 39% after the age of 4. And so this is something that we really want to think about in great detail, because we think about, okay, so caregivers are expressing concerns early on, and we also know that the average age of someone receiving a diagnosis from a non-minority background is earlier than a minority background. So another sort of red flag of area that we really need to be thinking about. But we also know from multiple papers now in the literature that early intervention can significantly improve outcomes for individuals with autism. And so when we think about this sort of early intervention window, right, most kids are getting diagnosed after that window. And Jesse will talk more about it, but early intervention is free, right? And it's delivered before under the age of 2. So generally before kids are in school, right? And so we want to make sure that, when concerns are brought to our attention, that we're really addressing them. And that's not to say that interventions are not helpful at various time points. They certainly are. I think the challenge is when concerns are brought up that have sort of been dismissed, or this idea of waiting and seeing, right? That's something that we really from my perspective, it's much less about the diagnosis and more about, okay, if there's a concern or a delay in a certain area, let's intervene in that area, right? Rather than sort of, waiting to sort of like see what the improvement looks like. And that's regardless of diagnosis, right? If a child is showing delays in speech or delays in motor skills, we want to make sure that they're getting the support that they need. All right. So also something good to know about. So the American Academy of Pediatrics has an autism screening policy. And this policy is wonderful. And one of the challenges is that it's not always used in practice. So being aware of this, I think, is really important. So it's recommended that at every 18-month well child visit that a family, a parent, or a caregiver is given this autism specific screening. It's a brief sort of checklist, checklist for autism in toddlers, and then that second screening happens between 24 and 30 months, because we do know that in some cases, we're not going to necessarily pick it up at 18 months. In other cases, there may be some regression or sort of a delay in gaining new skills during this period. And that screener, when it works, right, that kind of accesses, it's the step to the diagnostic evaluation and engagement in services. It is completely free. Anyone can take it online. So you don't have to necessarily wait for a pediatrician's visit. If your pediatrician doesn't do it, you can do it yourself. But certainly something that's really helpful to know about it and be aware of. All right. So for some people who are sort of wondering, what does an autism diagnostic evaluation entail, and how do you know what you're getting is sort of the gold standard, right? How do you know that what you're getting, you can sort of trust the clinician's impressions or the outcome of the evaluation? I think especially given that diagnoses are based on clinical observation and sort of semi-structured tools, right? There's not a blood test to tell you yes or no that somebody has autism. And so clinical judgment and the professional's expertise is really, really important. I think when something doesn't sit well with someone as a parent or a caregiver, it's important to really speak up, right? So, sometimes getting another opinion or getting a reevaluation later on can be really helpful. So I like this quote because the person who developed sort of the gold standard autism diagnostic assessment very clearly states that the judgment of experienced clinicians who are also trained on standardized instruments consistently adds information that to the sort of overall diagnosis. So taking the parent interview, taking the standardized observation, you also need that expert clinical judgment. So some measures to sort of look for, there's something called the ADOS, the Autism Diagnostic Observation Schedule. And I won't go into the details of the modules, but it's a semi-structured play-based assessment. There's modules from toddlers starting at 12 months all the way through adults. It takes about 40 to 60 minutes to complete. So not only is this sort of considered a gold standard assessment in combination with clinical judgment and the diagnostic history, but it's a gateway to certain things and certain services. So in some cases, for example, there's certain school programs through the public school system in New York that require certain modules of the ADOS for sort of entry into those programs. So the NEST program, for example, some people may have heard about. For OPWDD services so that's the Office for People with Developmental Disabilities, which opens the doors to many services and programs and support for families. It's required that you have a positive ADOS, that the ADOS confirms that somebody has autism. In some cases, some insurance providers require a diagnosis of autism confirmed through an ADOS to access services through insurance. So good to sort of know about that measure. And then the Autism Diagnostic Interview Revised is an extensive caregiver interview that also classifies an individual as meeting sort of criteria or not for autism. And then finally, there's other steps in the diagnostic process and things that are really important to understand and account for. So when we talk about what is this sort of clinical interview or psychiatric evaluation or clinical evaluation, there's lots of different terms for someone essentially taking the detailed history about the individual. So a medical history, a family history, developmental history, current strengths and challenges. As I mentioned, the diagnostic assessments. We also do assessments of cognition and adaptive behavior. So it's really important in order to determine sort of whether or not someone has autism to also understand where they are cognitively, right? Because we want to be comparing them to their mental age, not their chronological age, right? And this comes up a lot in sort of the differential diagnosis between just having intellectual disability, for example, and having intellectual disability plus autism. So understanding sort of those nuances can be important. Academic testing can be helpful for some kids who may also be showing academic challenges, right? Just because you have autism doesn't mean that you do or don't have a learning disability, right? Which is something completely separate that many kids also have. Speech, OT, PT, we'll talk more about, but really kind of understanding the full picture is really important. And I will pass it on to Jesse to move to interventions, but I'm happy to take any questions about the diagnostic process if it would be helpful, or we can go straight through.
You can go straight through. I don't think we have any questions yet, right?
Perfect.
All right, perfect.
Okay.
Thank you so much, Paige.
Thank you, Paige. Thanks, Sean. Yeah, so I'm going to be talking a little bit about the different interventions specifically available through school programs and through the state. But first, just thinking about what interventions each individual needs and at what frequency. So as Paige was saying earlier, there's such a broad spectrum of autism. And when you've met one child or adult on the spectrum, you've just met that one person, as she was saying. So we really have to think about what each family and individual needs. So we think about their age, their cognitive abilities, language level, any other comorbidities or behavioral difficulties they might be having, and then their adaptive skills. So that we're talking about things like their social and communication skills, but also their activities of daily living. So that might be things like eating and feeding and toileting, or for older individuals or those with higher cognitive abilities more down the line. We could be talking about things like how to get a job, write a resume, those kinds of things, how we can support them and their functioning in the world best. And in terms of the different sort of categories of interventions and supports, we think about behavioral interventions. So those can be things like therapy, cognitive behavioral therapy, social skills training for some individuals, also different kinds of ABA, and those can ABA can be applied in the home or in different school settings as well. Educational interventions. So depending on the age of the individual, we might be talking about early intervention. And then as kids get a bit older, the Committee on Preschool for Special Education, CPSC, you might hear, and then on to the CSC, the Committee for Special Education when kids are in kindergarten plus, luckily up to 21. And then there are these related services that Paige referenced, and I'll talk about in a little bit, but we want to be thinking about, again, the whole individual and what they might need that might be outside of the more basic educational interventions. So thinking at first about early intervention, so for those little babies, and again, we want to make sure we're providing intervention as early as possible to see what kinds of gains can be made, because the earlier we intervene, the greater gains can be made down the line. Again, intervention at any point and supports at any point are important. But the amazing thing, at least here in New York, early intervention is free. So at those screening visits with the pediatrician, or whenever anyone is concerned, they can make a referral to early intervention, and lots of services can be provided if it's determined that there's some type of developmental delay. So services might include speech or feeding therapy, occupational therapy, physical therapy, specialized instruction, parenting work and family training, and other things. So again, a really important program, and it's great if we can get kids in as early as possible and then sort of to ease that transition into the CPSE once preschool is starting. So services for preschool children 3 to 5 are again through the public school system, so free of charge to the family. And this might include the classroom setting itself, and I'll talk about this in a minute, but all of these special services are based on the idea that we want to put kids in the least restrictive environment that they need. We want to make sure they're interacting with kids who don't have necessarily learning differences or delays as well, if that is appropriate for that child. And at the same time, we want to be making sure that we're supporting them in their areas where they might have some areas of weakness or where they might need some support. So there could be a special class and a more integrated class. And we want to make sure whatever the setting is, they may have a SEAT, so a special teacher who's there for that individual child, and making sure all the related services are there as well. So what is the IDEA, the Individuals with Disability in Education Act? This is a law. It's just important to know it exists, we think, that makes sure we know that for our kids on the autism spectrum, it is the law that they have a free public education that's appropriate to them. So we're not satisfied by the idea, oh, this kid's just going to be in this class because we don't have something that works. No, that's against the law. The child needs to be in an appropriate classroom where his or her needs are met, and that it's in the least restrictive environment, right? We don't want to put a child in a class where he or she isn't challenged enough academically just because he or she might have certain behavioral problems or something like that. We need to look at the whole child and make sure that our kids are in an appropriate setting. So this, again, I keep referencing this least restrictive environment. I think it's just good to know sort of the different kinds of classroom settings that are available in the public school system. So there's a mainstream or general education classroom. Then there's integrated co-teaching. ICT used to be called CTT, a classroom where there's one general education teacher and one special education teacher where they're working together. And there's a mixture of kids who have IEPs or have needs that they need supported and those that don't. And then there's a self-contained classroom for kids who may have more needs and need sort of a smaller student to teacher ratio where they're getting more one-on-one attention. And in a class like this, all the kids would have an IEP or a classification by the Board of Ed. So the extra interventions available with the school system, these types of related services, just good to know what's available when we're thinking about our children and what they might need. Speech and language therapy, and the types of speech and language therapy we would think about depends on the level of speech they have. So some kids might be working on things like articulation or building the complexity of language, whereas some kids might be completely verbally fluent and they might be working on the pragmatics of language or a conversation. Then there's occupational therapy where kids might be working on adaptive skills, working on the independence of daily living, and also addresses things like difficulties with fine motor, like writing and eating and buttoning things. And it can also address sensory symptoms. Lots of people have sensory preferences with and without autism, have sensory preferences and sensory differences. And occupational therapy is a great way to get some sensory input and work on those things. And physical therapy is to address more gross motor development. Oh, Paige, you're muted.
Sorry, I'm muted. Hi, everyone. Mm-hmm. All right. So now moving on to just a little bit before we open up the panel, just for everyone to understand who the CBER Center is, what studies we're currently recruiting for, and also work that we're doing throughout the hospital that might be of interest. So the CBER Center carries many different sort of hats. So we're from the clinical space and the clinical research space, but also good to know that there's this sort of broader basic science community looking at molecular targets, human neurons, rodent models. So when we talked about sort of this genetic first approach, we take autism, genes are then discovered that create high risk for autism. These genetic mutations and deletions can be modeled into systems, so like rodent models, stem cells. Basic scientists can then look at the pathophysiology to really understand underlying mechanisms, changes in the brain. And then drugs can be developed specifically to target those mechanisms. And then we can bring this idea of novel therapeutics to clinical trials. And with this idea of when we start with these genetic syndromes where we actually know the genetic cause, we're using things like EEG and other types of biomarkers to try to identify individuals who show similar neural profiles who we would hypothesize would respond optimally to treatments that are effective in individuals with these known genetic syndromes. That's one approach that we take, but I think what I think sets CBER apart in thinking about groundbreaking work. So our assessment and genetic score, we see about 180 individuals a year through participation in research. We have a multidisciplinary team, and I think most importantly, and I think exciting for us, is that we're able to offer free autism evaluations through our research studies. And we also, through the faculty practice, offer diagnostic and neuropsych evaluations, individual psychotherapy, parent training, social skills group, pharmacological treatment. And we also have clinical and community partnerships within the community where we consult as well. So I'm just going to highlight 2 actively recruiting studies. We have one study with the sort of nickname GALA, looking at the genetics of autism in Latinx ancestries. So again, families who participate do get free autism evaluations, and we also collect a genetic sample, so either a blood draw or through saliva. So we talk about sort of all these genetic samples we have that have led to gene discovery, but these samples and the research is historically sort of not as representative of diverse populations, and so that's where this fits in. We can see families who speak Spanish as well as English, and kids through adults are eligible. So feel free to reach out or refer individuals to us for that. We also have a clinical trial looking at growth hormone in individuals with autism spectrum disorder, as well as Phelan-McDermid syndrome. For this clinical trial, we're enrolling kids 2 to 12 years old. This study is specifically also for individuals who have autism and intellectual disability. It's about a 7-month study, 2 12-week phases with a washout period. I won't get into the details, but I'm happy to talk more about it if anyone might be interested in a clinical trial. And then we have a survey study where we're surveying caregivers of individuals on the spectrum to try to better understand what sensory tools, materials, things they've tried for their child on the spectrum and what has and hasn't worked for them. So trying to better understand sensory interventions. My research focuses on sensory processing. So I developed a sensory assessment for children, and we're now moving towards an adult version, which will involve sort of an adult interview about sensory preferences. So feel free to reach out about that as well. And then I'll pass off the last couple of slides for Jessie.
Yes, we just briefly wanted to talk about a couple of resources available here at Sinai for those who might be interested. First, in PEAK, our educational platform, we do have a module that's available to all Sinai employees about supporting individuals on the spectrum in a medical setting. And we're so lucky we developed it with input from caregivers of individuals with autism and also clinicians and staff and everyone who encounters people on the spectrum here. So we would love people to take the course and would love feedback as well. We also have individualized sensory toolkits that we can provide to patients in all clinical settings. We have an image of those right here. And we developed them actually with a group called Spectrum Designs that employs adults on the autism spectrum. So it was great to get to collaborate with them there. And we just want to make sure people's sensory preferences are met when they're coming through the hospital. And so if you'd like any, please reach out to us. We're happy to provide them to your group. We also have social stories for medical visits and a video resource library on our website on different topics of interest that you could always view yourself or direct patients and families to. And we're also happy to meet and discuss and have more sort of personalized consultation anytime with any group. We really appreciate your reaching out to us and can't wait to hear the next story as well. So thanks.
Awesome. Thank you so much, Paige and Jessica. Before we open this up to questions, that was a lot of really good information. And don't worry, everyone, this is being recorded and we will share it after the fact. I want to pass it over to Martha. Thank you so much for joining us, Martha. So the first question I'll have for you is, tell us a little bit about yourself and what you do here at Sinai.
Sorry. So I am a master's student, and I'm also an associate researcher here. Yeah, so just finished my first year.
Oh, congratulations.
Thank you.
All right, so let's start off with some fun. Tell me 3 of your favorite things to do in your spare time.
In my spare time, I like to bake. I'm really into baking. I like to go to, either listen to music or go to music events. And I love playing with my cats. I have 2 cats at home.
See, the baking I can do, the cats I can't do. I'm a dog person. But no,
I was a dog person too.
All right, that's really good to know. Now, I have a child who's diagnosed with autism, right? But at what point in your life did you know that you were living with autism?
I don't know if there was a specific point. I think that for most of my life, I was the weird kid. I was really struggling with making friends, keeping friends. As a kid, I did definitely, there were even family members who were like, "Are you sure she's not?" But I think because back when I don't know exactly what the rules or the laws were in the 90s, but when I was born, I think there was still the logic that it was only or predominantly in boys. So I didn't even get an assessment or anything like that. Not until as I got older and I started to go to therapy because I couldn't make friends, then I looked into it myself. And that's when I thought maybe this is what it is. And I had to seek out a formal diagnosis.
Okay. Because I think when Paige was referencing it earlier, that early intervention and early detection, it can always be a little tough, right? And kids are kids, so you try and let them be kids in the beginning, but then there are certain things that happen that might be high symptoms or high signs where it does make you want to get them checked. So that's interesting. That's actually and I talked to a couple of people. That's the first time I've actually heard of that. And, I applaud you for that because, that's a real extreme sense of self-awareness and really wanting to know. And, I thank you for being vulnerable with us on this call because that's real important for anyone else out there who may have questions. So thank you for sharing that. Now, were there times where you felt like someone tried to limit your potential due to maybe noticing some of these traits?
I think for the most part, I don't really disclose at least my diagnosis, mostly because I did have one situation where I did to like a classmate. And then shortly after, they started kind of talking to me slowly, maybe kind of trying to like dumb things down for me. And I didn't really appreciate that all of a sudden I was being treated differently, even though we were both taking the same classes, we were both doing the same thing. So then I didn't really tell people anymore. I think that's the only instance because I keep it private for the most part.
All right. And I think this is one of the areas where I really, thank Eating and, the ADAPT ERG for being that resource because with anything, when you represent a community, it's almost like the weight is on your shoulders to be the representative sometimes, right? Like, you don't want to have to always reveal things about yourself, but almost sometimes it's like, if who's going to be the voice, if not you? So do you ever feel that pressure, as you're going through your life?
Sort of, yeah. I think that for being an adult and then being a female, and then also being, I guess you can call it like successful, like I'm in a master's program and stuff. It's kind of tough, especially when, you know, even therapists have told me, like, I don't know, you're able to make eye contact sometimes, so you know, you're able to talk to me. You got that one joke that I said, so you're not, you know, just to, you know, have that. It's hard to even myself believe it, and on top of like trying to tell other people, you know, educate other people as well. But at the same time, I think it's really important, for people to understand that it really is a spectrum. Just because you can't tell doesn't necessarily mean that they're not struggling with it.
Absolutely. Thank you for sharing that. So how did you feel when you first heard the diagnosis?
I honestly felt a little bit of relief, because I'm the type of person that you know, I could look it up all day long. I could find things that relate to me, but I want a formal diagnosis of this is what I have, because I don't want to be a self-diagnosis and it be wrong or something. So it was definitely relief. It was something that I needed for a long time and that I took way too long to receive.
Oh, thank you. Thank you so much for sharing that. What do you wish for everyone to know about autism? I mean, I know what's my goal when I talk to people, but I always like to know when you talk about it, what's your main thing that you'd like everybody from this session to leave with?
I think something that's really important, is, you know, children that are autistic end up being adults that are autistic. You know, it doesn't necessarily go away. Like we said, there's no cure. And I find that as you get older, there is less and less, uh, help for adults, which I understand. You know, we want to get to the early intervention, but some of us were under the radar, some of us were missed. And now as adults, I guess we're kind of punished in a way that because we didn't get the intervention, well, sucks for you. You know, so it would be nice if there was more support, more understanding, and then also, you know, maybe more education on being able to help in a sense, especially the people that are not as, I guess you can call it, autistic as other people, or as, I don't know how to call it, like, not as obviously autistic, I guess you can call it.
I mean, we got two clinicians on here. Help her out. No, I totally understand where you're coming from. So you complete your first year. What's next for Martha? Like, what's the goal as you go through this program?
Um, for me, I really want to potentially go into research. I do want to maybe in the future be a PI. I'm not sure. Um, just because academia is so hard, especially for neurodivergent people. So I'm not sure if I would be a good fit, but maybe I can break that boundary and do it.
Hey, we don't let doubt creep into our minds when we set goals, okay? If they're gonna get anything from this session is that you can do it. So make sure that you create that lexicon in your mind that anything you set your mind to, you can complete, because when we're a part of marginalized communities, we wear this hat. We are the representatives, right? And as much as we don't want that responsibility, we have it. And on your shoulders, there are going to be a lot of kids, especially if you reveal your diagnosis, that are going to look to you and say, wow, she did it. I can do it too. So always remember that as you go through this program, okay?
Thank you. Appreciate it.
All right, excellent. And last question I'll ask you, you have 15 minutes with anybody in the world to have a conversation. Who would it be?
Oh, that's tough. I think one of my really big special interests is Frida Kahlo. I'm obsessed with her, and I think it would be so great to have 15 minutes and just tell me your life and everything. She's great.
All right, great. Thank you. How about you, Paige? You know, she wasn't the only one on the clock. 15 minutes, who would it be?
It's funny you just said that. 15 today, if I'm answering today, it would probably be Jimmy Butler because I'm a big Miami Heat fan after last night. But if you asked me this yesterday, I'd have to think more about it. But that was the first person who popped into my mind just now.
Hey, that's a good conversation. When you talk about work ethic, Jimmy Butler is definitely one of those.
Yeah.
How about you, Jessica?
15 minutes. I would go, this is a little crazy, but I would meet with my kindergarten teacher again. For 15
You got to tell us the backstory.
Miss Blumenthal. That's her. I don't know where she is, but yeah.
I know there's an interesting backstory. If you don't want to tell everybody, it's fine. We'll talk offline.
We'll wait for the questions. Yeah.
All right, excellent. All right, Eating, I'm going to pass it to you. Let's get some questions going.
Sounds good. And thanks again to our panelists. I'm seeing lots of good questions coming in. I put this in the chat, but if we don't get to any of those, we'll try to get back to you offline. So let me just pick some that sort of stand out that we can address now. This is a question for, I guess, really any of the panelists. How do you recommend people, adults that have not been diagnosed, to seek evaluation?
I'm going to answer it. I'm just, I thought I saw maybe, I think there were two similar questions, but I could be wrong. Someone just asking generally and someone asking about adults. Is that right?
That's right. So for adults, what would be your recommendation?
So for adults, I would really recommend going to an autism specific center. Luckily in New York, there's many options. So there's our center at Mount Sinai. There's the Center for Autism and the Developing Brain called CADB at Weill Cornell in Westchester that has an adult program. NYU has a program. So really going to a specialized autism center, you really want to make sure that the evaluation is being done by someone with expertise who sees many adults for diagnostic evaluations. I think that's really important. There's also some providers in the community who do private evaluations very well as well. We're always happy to give referrals if people reach out to us and we're not a fit or they're looking for a referral closer to home, they can certainly reach out.
Thank you, Paige. And then another question, probably more for the clinicians. What defines autism versus ADHD? What are some key differences there?
Sure. Should I, Paige? What we could do, I'll start. But,
Okay,
so with autism, where the core deficits are the social communication is the area that is the difficulty. There can be difficulties with social communication and sort of getting along with other people and all in ADHD, but usually that's secondary to having difficulty focusing or having attentional issues or being so impulsive that they might make social approaches that might seem different or odd to other people. So you can also have both. You can have autism spectrum disorder and ADHD, and those can be comorbid, but I think it's just thinking about, you know, whether when there is hyperactivity or inattention, which are sort of the core features of ADHD, thinking about whether that is the main issue or it's more social communication and then restricted repetitive behaviors.
Yeah, and I guess also, I think one of the changes between the DSM-4 and DSM-5, in the DSM-4, you couldn't diagnose both, even though clinically many people were seeing that these are two different things with totally different diagnostic criterion. And in the DSM-5, you can diagnose both, and about half of individuals who receive an autism diagnosis also have ADHD in combination with autism, but they are very distinct and also can make the sort of diagnostic process more complicated and complex, and really why you need to see a specialist, because individuals with ADHD, as Jesse mentioned, right, can have delays in their social skills. They can have sensory symptoms, but they're two completely different diagnoses, and the diagnostic criterion are different.
I wanted to say from my experience, I came into that evaluation only as an autistic evaluation. And then as I spoke to the specialist, they said, I want to try the ADHD evaluation as well. And yeah, it turned out that I did have both. So yeah, that was definitely, they really are two distinct, like, at least when you're doing it yourself.
Thank you. There are two questions I think I'll address to Martha first, and if the clinicians would like to jump in, please feel free. The first one, one of the attendees said that their son received early intervention but was never officially diagnosed with autism. He graduated from college and is working. Socially, he struggles and is distant. They believe that he is on the spectrum, but have never had the discussion with him. Do you recommend that we have a conversation with him? So I guess for parents of a person with living with autism, potentially.
I think it really depends on the personality of the individual. I mean, I know that for me, I would have really appreciated having that kind of a conversation, knowing that I had difficulties, but some people that I know live their life comfortably without really having social, that kind of interaction. So I think it really depends on, if that person is trying to understand why they are having difficulties, or if they're happy with the way that they are, then maybe it's best to just keep them happy. It's a little complicated.
Thank you. Another attendee says, asked Martha if you wouldn't mind sharing the struggles that you faced, more specifically socially in making friends. They noticed that their daughter struggles with making friends at times, and also speaks at times as if she is of a younger age, can get fixated and worries on certain things.
Yeah, so as a kid, I didn't really, and even now, I still don't really understand, when is the right time to talk, if I'm going to speak over them, or in the conversation, saying a certain thing that might upset people that I might not realize, or so sometimes that creates a distance between people. And also trying to understand, like, for me, small talk is very complicated. It's very difficult. And so as a kid, I ended up just mimicking what other people would do. So how they said it, then I would do the same thing, and it worked. So I think that creating a fake persona then makes it really difficult to keep up. And over time, you can accidentally make mistakes or say something that could upset people. So then over time, people just start to, or they find you like, oh, you talk too much, or you don't talk enough, or it's just really hard to manage all the social cues.
Thank you for sharing. We have a couple questions in the Q&A. The first one, and I think these are probably for Paige or Jessica. How often are standard diagnostic instruments and ASD diagnostic formulations assessed and revised?
Sure. So there's ongoing research. I would say, so the ADAS has been the international gold standard for many years, and is last was updated about 10 years ago. And like we said, the ADAS is really sort of an important measure, but it's needed in combination with an expert's clinical judgment as well. People can certainly meet for the wrong reasons. And so, but in all of these areas, there's a ton of autism research going on, and things are being updated with larger samples that are more diverse, right? Like as the field is kind of moving, learning from the gaps, these things are getting updated. But I don't see, I don't know, Jesse has a different opinion, but I don't see the ADAS getting replaced by something else anytime soon. And I see that the other question about options for pharmacotherapy in autism. So if anyone is interested within the psychiatry department, We have, there's a number of psychiatrists who have experience and expertise with autism who could provide consults if families are interested or curious whether their child or may benefit from medication management. There are no medications approved for the treatment of autism. So it's often medications that are targeting things like anxiety, ADHD symptoms, but those internalizing and externalizing symptoms can have a huge impact on daily life. So certainly anyone who's curious and learning more about it can reach out. I'm happy to share. There's a social worker within the Department of Psychiatry who could help guide families to an appropriate clinician. Families can also reach out to their child's pediatrician or to primary care doctors for local providers who take their insurance.
Thank you. With that, we're out of time. Sean, would you like to give the last word?
Oh, I just want to say thank you to Jessica and Paige. Excellent presentation, a lot of information. As I put in the chat, we will be sharing the recording. Martha, thank you so much for sharing your story, for being a part of this. Too often we have conversations and sessions about a community without the community being present. So we are so happy that you were present today to share your story. Yiting, thank you for being my partner in crime in this. This was really great. Once again, a thank you to everyone attending today. Please do not hesitate to reach out to anyone on this panel for any more information that you would like to get. And I just wish you all a very, very good day. And just being a father of a child who is on the autism spectrum, I can tell you, as they took you through all of the different sessions, all of the different phases of going through the testing to actually receiving the diagnosis and actually being a caregiver, it is not an easy process, but I'm telling you, it takes a village and it takes consistency and it takes vulnerability. And I hope that we see some new faces and new voices at future sessions like this, sharing their story, being vulnerable. So just be on the lookout for that. Thank you all so much.
Thank you for having us.
Oh, thank you. Appreciate it.
Thanks so much for having us.
So a lot of love in the chat. Looks like everybody really liked it. You all did great. Thank you. Thank you so much. Those slides, are you able to share those or are those for
Yeah,
interview?
well, no, we're happy to share them. We can send you a PDF. Maybe is that what's easiest?
That's perfectly fine.
Perfect.
Hi, everyone. Great presentation. I'm so sorry. I thought I was going to go in the participants, but I ended up on the panelists. I am so sorry.
It's
But happy
okay.
to be